But, it's okay. We're one step ahead. We have to, I think we have to be, as all of us have to be our own best health guru and look after ourselves as best we can and be as healthy and as fit as we possibly can be. I eat organic food only. I don't have any processed food. Everything's freshly prepared. I drink mineral water or totally filtered water. I take my vitamins and minerals every day because, unfortunately, the food production now the food that we eat doesn't have all the vitamins and minerals and trace elements that it should have in the quantities it should have. So even though if you're eating a good diet, you could still be deficient in some of the micronutrients and things. I take iodine every day. I exercise every day. I probably eat one meal a day. Most of the time. Today I'm not eating anything. I'm going to do
You're more disciplined than I am. That's fine.
48-hour fast. I'm not going to eat today. And I had supper. I had supper last night, so it's 24 hours tonight. But I'm not going to eat till tomorrow night. So I'm going to do 48 hours because it's very good for your body.
Oh, it is. It's just difficult.
Sometimes.
I tend to fast till I get hungry. Then I go and get something to eat.
Yes, that is one way of doing it. But only eating when you're hungry is important because we don't need 3 meals a day, and we should. And also, the Japanese, they stop eating when they're 80% full. That's another good tip, really. Yeah. I find that hard because once I start eating, I want to eat a really big meal. But once a day is for me is good, and good sleep. And every morning I go out and I ground on my grass.
How long do you have to do that for?
Well, some people say a minimum of 6 minutes. In the middle of winter, when there's frost on the ground, I believe 30 seconds will do because it's cold. But come the nicer weather, warmer weather, I will go out there and I'll deadhead my flowers and I'll be barefoot in the garden for
long term.
half an hour before I come in.
If it is an electrical earthing effect, if that's the case, that should be just a few seconds, theoretically.
Well, it should be, shouldn't it? Yes. I tell patients
a
few seconds,
effect,
really.
I don't tend to know.
Yes. I have a grounding sheet on my bed as well. I sleep on a grounding sheet, and I found that makes my sleep much better quality and for longer. Yeah. So, I think we all have to do all of these kind of things.
And find out what works for you as an individual.
Yeah, exactly. And I like going out in the golden hour, the first hour of the day when the sun is just rising, and I like to see the sun rising. So, of course, now I'm getting up earlier and earlier, but that's fine because I naturally wake up with the sun. Yeah. So, I go straight. Some people aren't morning people, are they? And they have to sort of wake up slowly. Whereas once I'm awake. Oh, is that you? Once I'm awake, I want to get up and get on with the day, So I'm out and down, and it's dark usually when I get up. And then when I see the sun is starting to come up, I go outside and do my grounding and look at the sun. Mm-hmm. Yeah, the brightest part of the sky.
Yeah.
And set the circadian rhythm.
Indeed, yeah. Oh, get the sun early in the morning, absolutely. Just to finish, Tina, you mentioned it's a separate topic, really, but you and me were both. Well, I would say conned into taking this wretched COVID vaccine. Before that, we were innocent, we trusted, and looking back, it means we were naive, which we didn't realise at the time. For your, the first 38 years of your medical career, did you basically just accept that which was handed on down to us by those on high, like I did?
Not totally. I was always a bit of an independent thinker, but I did think that the studies were true and trusted and journals and things.
I think at the start of our career, I think they were.
Yeah.
I think things have got worse in the last 10 years.
Yeah. And that's confusing, isn't it? Because to begin with, you could trust a lot of things, maybe. Yeah. And so you get into that mindset, and then it's working out when it starts to change and when it's not. So I did general practice for 7 years when I first qualified as a GP. Yeah. I was a GP. And I really didn't find it very satisfying because I could not sort people out in 10 minutes. And in some surgeries that I worked, they gave me 7 minutes. I mean, how can you do that? And
ridiculous.
And I felt that also I didn't like prescribing drugs. So I was always trying to look at the holistic kind of approach and lifestyle and so on. And I would find that I always ran about an hour and a half late because I'd give everybody 15, 20 minutes. And I would feel that actually what they needed was a new job, a new house, maybe a new man. You know, there were lots of things which I couldn't sort out for them. No, I couldn't write a prescription for them. So I used to give them lots of support, emotional support, and it was very draining for me because I was giving out loads and loads of positive energy to people.
Very hard work.
Yeah, and they would go away and they'd be enthused and a little bit up for a bit, like they plugged themselves into me and got some of my energy, you know. And then they'd come back a few weeks later and I think, oh, you know, what can I do for these people? They actually need to earn more money. That's what because this is, you know, they can't live like this. So I did that for 7 years and I thought, this isn't for me. I can't do this. And I wasn't prescribing loads of drugs like some of my colleagues were, because I just didn't feel that was the right thing to do for people. And nature was more powerful and better. And I was worried terribly about all the side effects of drugs. So I was a bit of a sort of independent thinker there. And then I moved into contraception and women's health and sexual health. And that was a very sort of much safer zone for me to work in because everybody was well. And they really liked to come and see me to chat about what they wanted and what they could use and everything. And it was like seeing a whole load of friends, really, chatting away, and they'd tell me everything. And that felt very satisfying. And I started developing the services from nothing virtually. And we opened lots of young people's clinics and we were getting the teenage pregnancy rate down. And these young people really trusted us. It was fantastic. Trained lots of staff. It was a great service and I was working in that service for 24 years. But for the last year it was destroyed because they took 30% of the budget just overnight, closed 36 weekly contraception clinics in one day in Surrey, and they went from 20 sites to 3. And it was just heartbreaking. And for a year I worked in the new system and I just couldn't do it. It was just awful.
And you became a menopause doctor.
Then I became a menopause doctor. At the same time, I'd already been doing that a bit and just concentrated on the sort of older ladies. And from general practice onwards, I'd been seeing menopausal ladies. So it was just a very natural progression for me. Really. Became a menopause specialist. But in 2016, my daughter, I think I explained before, had the mast cell activation. She became very, very unwell. And that's when I developed this acute interest in MCAS because I had to sort her out. And it just went on from there, really. But in 2020, when things started to happen, I started to see a few red flags and started thinking I had been very, very, very naive up until that point. And I just started thinking, hang on, that doesn't make sense, you know, and that's not scientific. And why are they saying that? Because that doesn't work. And why are they closing the GP surgeries when they should be opening them for longer? They've got all the normal people to see, the coughs and colds, depression, cancers, etc. And they've got the COVID patients to see. But what did they do? They closed them. It just didn't make sense to me.
It's not a nice place to be, really. I mean, we're kind of in the real world now. But, you know, it was kind of nice when you could trust nice guidelines and when you thought that what was published in a journal was genuinely the best possible science and... when you could trust your senior medical officers and, you know, you had this hierarchy of respect. It was a nice, comfortable place to be. Now, when we see the nature of the corrupt reality and the compromise of science and the compromise of medicine, it's a deeply uncomfortable place to be. But I'm glad I'm here because it's real. I now perceive that which is reality rather than living in some... delusional matrix world. It's
I agree with you. I agree. It's a hard lesson to learn, and I felt quite bereaved for about 3 months when I started to really put the picture together.
It's a grieving process, isn't it? You're grieving for the security that you once had.
And I felt very scared about the future. And, you know, when you have children and grandchildren and things, you think, oh, my goodness. Yeah. But, you know, I've got used to the ideas now of what the truth really is. And what I have seen is the most amazing people, incredible people who are very resourceful, very intelligent, very caring, and very strong.
And your mind has been liberated to advance. You know, you're now essentially a medical researcher, albeit through practice.
Yes.
But you know, it's developments that wouldn't have taken place otherwise.
No, absolutely. And just when I thought I was going to sort of semi-retire and go, you know, start slowly winding down, I found myself having more and more clinics and more people, and having to use my brain cells more and more, which has been an interesting and exciting challenge, really. So, you know, we're all here for a purpose, aren't we?
I believe so. I'm convinced that's true.
I think so.
If you're watching, you're here for a purpose. I believe that is absolutely a fundamental truth about human existence. Tina, always fascinating. Before we came on air, we did talk about another couple of things, which I'm not going to bring up now. but you are sending me some information on them, which I'm going to look at. And it would be nice if we talk again about that. So some tantalising things ahead, some really interesting developments in non-invasive medical interventions that can perhaps influence a wide range of conditions. But if you send me the links, we'll look at them and we can talk again if you'd like to.
Yeah, that'd be great.
But for now, that is brilliant. Dr. Tina Pierce, as always, thank you very much.
Thank you, John. Thank you.